And now I'd like to bring to you Mr. Ernest Jura, CEO and founder of Collabmed. Let's give him a round of applause as he comes to the stage.
Good evening, ladies and gentlemen. You all look dashing today. It's a pleasure. And allow me to tell you about the power of an SMS. In 2008, I had the pleasure of implementing a digital system for an antiretroviral therapy system at a district hospital sponsored by the USAID. The system was tracking HIV/AIDS patients who are on ART treatment and shooting out SMSs to those who failed to turn up. That simple, basic implementation of data digitization and analysis improved patient throughput by 30%. We were able to get 30% more patients coming in on time for their drugs and for their treatment. So we ask, can healthcare insights save lives? Yes, it can and it does. And we are doing it at scale. 1.4 billion Africans and growing disproportionately receive lower healthcare outcomes than the rest of the world. 97 million of these, 9% of the population, face some catastrophic healthcare incidents every year, and 15 million of them are pushed into extreme poverty. To a greater extent, and fundamentally, this is caused by poor and inadequate health data and analytics. Africa makes up 17% of the globe and bears 25% of the disease burden, yet only contributes 3% of healthcare data to clinical research. My people perish for a lack of knowledge. This is our goal. In 10 years, we are going to have 160 million unique patient lives on our platforms. And by 2030, the African healthcare value is projected to be at $259 billion US. We are going to be at the center of this transformation. The value single and processed complete patient data set would generate $1 in annual recurrent revenues for us every year, if unprocessed. If processed with value addition, it would generate $7 US to us. Thus, in 10 years, simple mathematics, we would have revenues between 160 million to 1.1 billion US dollars in revenue. On average, conservatively at $500 million US. Where we are right now, currently we have 1.5 million unique patient lives on our platform, so definitely you're looking at, we're sitting on 1.5 million US dollars every year. But we haven't yet gotten to extracting it. We have 6.5 million prescriptions and 4.8 million lab requests. We have 57 facilities that use our systems across 4 different countries in Africa. And they see 15,000 patients per month through our platforms. We want this map of Africa to be red, because there are going to be thousands and thousands and thousands of them. Ascent, we were focused on healthcare automation and digitization. Now, through Ascent and our valuable mentor cart, we are able to get to the awakening that healthcare analytics at scale is our ticket to the moon. Ladies and gentlemen, allow me to introduce you Ascent and Collabmed's progeny, Afya Analytics. We are truly grateful for what Ascent has done to us, and through Afya Analytics, and through the data we already have, and the data we generate every day, and data from independent organizations and institutions, we are digitizing healthcare analytics at scale. In tandem, we are still automating healthcare in facilities through Collabmed. You may ask why? The data we are automating is still funneling into Afya Analytics. And 80% of 130,000 healthcare facilities across the African continent are still manual, paper-based, and non-digitized. In 3 years, we will have 60 partners in 8 countries with 480 facilities using our platform and 10 million unique patient lives on the Afya Analytics platform. Partners are key to our scale. And to look at this, let us focus on one partner, Konza. Konza is not only a technopolis building a smart city outside of Nairobi, but through Konza, we are focusing on digitizing healthcare facilities in government public health facilities. Konza is a government initiative, and they have the mandate through the Ministry of Health to digitize 7,400 health facilities, and through this, we will impact 16 million unique patient lives. We are the only health tech company that they are partnering with. Yes, there are many companies that have seen the opportunity, and to highlight one, Helium Health, and their focus is on an acquisition strategy, acquiring companies that do digital health across the continent, with a wider focus offering digital solutions to any facet of healthcare automation. For us, we are focused on automation and analytics, building on a partnership model across the entire continent, because we believe this will be the fastest way to scale. By 2027, we will have revenues of $5.9 million, and you can then see that from 2026, there's a hockey stick curve. That hockey stick is not coming down, because at that point in time, Afya Analytics, healthcare analytics revenue is kicking in. For those of you who are lucky to partner with us, we are asking for $1.3 million US over the next 36 months in 3 tranches, and this would largely go into partner engagement across 8 countries and business development, research and development for the Afya Analytics data play, and administrative expenses as well. We are truly blessed to work with brilliant individuals in their own right, and collectively, they have brought their knowledge and experience into ensuring that we deliver on this audacious goal. Cedric Seeger, client lead, an amazing gentleman. Purity Kinoti, project and partner lead. She does an amazing job with our projects and partners. Dr. Rhoda Kriet, who has given us client perspective lead on the systems. Mr. Paul Kukubo is our board chair. He's an astute gentleman of standing in this society, and he's the founder of 3Mice and the former CEO of the ICT board. Stephen Sira is a director, strategy and partners, and also serves as the CTO of the World Wildlife Fund globally. He was in the founding team of the Africa Online and was part of the team that rolled out Africa Online across the entire continent. Sorry, what excites us is what pains us. And you may ask why. It's not the 1,000x growth that we're going to have. It's a fact that post-ChatGPT, post-COVID, post-Google and YouTube and undersea cables, millions and millions of lives are still being lost needlessly. And what excites us is the fact that we are at the cornerstone of staving these off. So we welcome you to join us, and thank you very much.
Thank you. A round of applause for Ernest. Thank you very much. Don't leave the stage just yet. We have, I'm just teasing. We normally call him the gentle giant. He's huge but very gentle. So I'd like to give you this opportunity for questions. If there are any questions in the room, we have 8 minutes. Any questions? All right, there's a question back there.
No? Okay, there. Hi, thank you for the presentation. I do have 2 questions. I think the first one is around data privacy. How do you manage that, given that this is information that belongs to patients? Do they give consent for you to share it with other healthcare providers? And then I think my second question is around the fact that we know one of the biggest challenges to healthcare is the fact that my medical history remains with my hospital and not with a patient. We don't walk around with our medical history. We never get it unless we ask for it. Isn't there an opportunity to use your tools to empower people to be able to better know how they are, what's and well, to follow their own history, to make more empowered medical decisions. I think I'm really keen to know what could you do to empower the patient more than you are empowering perhaps the hospital. Yeah.
Okay. Thank you very much. So on the first question on data privacy, with regard to healthcare data, to use it, we first of all have to anonymize that data. There are laws and restrictions around how we use that data. We are registered with the data ombudsman, and so we are data handlers. So there are certain conditions we must meet, and we meet those conditions. So upon anonymizing that data, there's a way we are expected to use that data for greater good. And the onus is upon us to use that data for greater good. And so that is something that is happening, and there are regulations around how that data is used. Thank you. When it regards to a patient's history and having an individual patient work with their medical records, it's a very beautiful dream, and it's very possible. Unfortunately, where we're starting from, 80% of healthcare facilities are not digitized. That's the elephant in the room. Before you work with your data, it has to be electronic in one way or the other. The reason why you don't have your records is they're sitting somewhere in a file. And as opposed to popular opinion, a manual paper-based record is more secure than a digital health record. Thank you.
All right, we'll take one last question. There's a question at the back there.
Thank you. Again, I'm a big fan of automation, so this is really beautiful. Good stuff. A quick response to her question, there is a company called Afia Records, and Afia Record basically does the things she's asked, automating patient records and giving patients access to their records. They work with the Ministry of Health. They have so far worked with 1.5 million patients. So you may want to check them out and probably pursue a partnership with them. Now, to my question, digitization of the healthcare has been quite a pain and slow in adoption, in spite of Kenya government leading in digitization of services, now at 60%. The president is really pushing for all services to be digitized. What are the main challenges you're facing with public facilities and digitization of health service delivery? And what's your plan for navigating that so as to increase your pace?
Okay. Thank you. So let me use one word to answer that question, right? And expound on it, practicality, right? So when you're rolling out technology, it has to be practical, it has to be usable. The challenge has been a one-size-fits-all technology rollout within the African space and within different subsectors. So Africa and I would say is a bit peculiar because you have and similar to, sorry, can you hear me now? Yeah. So areas that are very developed and similar to Europe, and then you have very, very remote areas. So what do we think of when you're rolling out to like a healthier system across a county? First and foremost, we have to look at, so with Konza, we have something we're calling the county healthcare management system. And that encompasses from the community health worker all the way up to a level 5, level 6 facility. Now, at the community health worker level, what are their challenges, first of all? What opportunities they have? They have a mobile phone, and they have connections to that community. We empower them through that mobile phone to report on healthcare outcomes at that village and create a referral system that flows through. That's practicality, using what they have and using technology that exists. It comes to the level 2 and the level 3, very different demands, because even budget-wise, they do not have as much budgets as a level 4. Just there are also few. So what do? We empower them with tablets that are connected to the 4G and 3G networks, and the reason for tablets is because of power, right? So when the power goes off, they're still able to operate through the same platform. When it comes to level 4, there's a requirement that they must have a backup power and a level 5 as well. So there we can then be more sophisticated. So it's all about practicality and training and getting these users to pick up the platform. Thank you.
Thank you very much. A round of applause to Ernest. Thank you very much, Ernest.